Dear students, welcome back in our today's session. Second part of sedatives and hypnotics. In first part, what we had seen, what is the hypnosis, what is mean by the sedation, what is the mechanism of action of the hypnotics or sedative, in what manner these hypnotics and sedative produce action, as well as we had seen what is the importance of sleep in our human life. That is one of the very important thing that we had seen in initial lecture. In this lecture, as well as we had seen the mechanism of action of the different drugs like some barbiturates, some non-barbiturates, as well as the alcohol and non-steroids. In today's lecture, what we are going to see, today we are going to see what are the different mechanism of action of barbiturate on other parts of the body, as well as the other system of our body. And what is the possible side effect and where we could prefer this barbiturate in the treatment. So this is our today's intention for the lecture. Then let's see. First one is why barbiturate is considered as one of the popular sedative and hypnotics. What is the reason why it is to be considered as a popular sedative and hypnotic? Because this particularly barbiturate, they are very lipid soluble in nature. And as we know very well, lipid solubility is related to the potency of a drug. As high lipid soluble drug, it is more potent drug, as well as it is a shorter duration of action. And this potency plays a very important role that we should have start the treatment within short period of a time, and duration of the treatment should be in a short way. That is, as we finish the need, immediately it should get removed off from our body. By this reason, this barbiturate is to be considered as a famous popular sedative and hypnotics. And the most important thing is that as barbiturate is a lipid soluble in nature, so definitely it is to be considered as it is a water insoluble in nature. So with these physical properties of barbiturate, the barbiturate has a pharmacological action, different pharmacological actions of the barbiturate. Initially, first we will see as a central nervous system. CNS, which is the most sensitive part with the barbiturate, and already we have discussed that barbiturates or the hypnotics and sedatives are related to each other as a dose dependent manner. There is a change in a dose, there is a change in action of the drug. So barbiturate produces dose dependent action. In shorter initial dose, it acts as a sedative. In higher dose, it acts as a hypnosis. Even though in higher dose, it produces anesthesia, until whenever we increase the dose of the barbiturate at higher risk, then it produces the coma. So that is its effect on central nervous system. That is a definitely dose related manner. So in this dose related manner, this whenever we use 100 to 200 milligram for shorter duration of action, it is act as an hypnotic. It reduces the fallen time, sleep fallen time, as well as it increases the duration of sleep also. And the person can arouse sleep, but the subject may feel confused if awakened early. That is one of the very important thing with this barbiturate. Next, one thing is night awaking is reduced because of the sleep cycle. Sometimes the sleep cycle is get disturbed. In between, in midnight, we get woke up, and again, it is very difficult to get a sleep. Many of the patient are listening, or many of the patient are get suffering from this condition. Why? Because of the number of the reasons like anxiety or any other condition. But when the patient is on any barbiturate treatment, so this point night awaking is get reduced, as well as rapid eye movement sleep is also get reduced, and rebound increase in rapid eye movement is noted after sudden withdrawal of the sleep. So if we are in a treatment, it should have a good effect, but we can't suddenly stop the drug. We should have tapering of the drug. After certain days, we should reduce the drug quantity, reduce the dose, and then it will give it doesn't give its withdrawal symptoms. That is one of the important thing. And one of the notable side effect, one of the notable point with the barbiturates are the hangover. What do we mean by hangover? That is nothing but some dizziness or distortion of mood in early next morning. That points are get noted when the patient is having 100 to 200 milligram. When we are using for the sedative dose, that is again we reduce the dose, then definitely it produces some drowsiness to get start initiating the sleep drowsiness. For the reduction of the anxiety and excitability, it could be used. Due to this, it has some impairment learning as well as the short-term memory as well as the judgment is get arise. Some patients are getting euphoria. Some patients are showing some euphoria. So this is what about when it is used as a sedative. When we are using as an anticonvulsant, so we know barbiturate is one of the good drug for the anticonvulsant activity, because in convulsion, patient is get excited and it is necessary that we should depress the central nervous system. So for the depression, this barbiturates are preferred. So this is what about effect of a drug, effect of this barbiturate on central nervous system. So apart from this central nervous system, some other systems are some on other system it has an effect like on respiration. So usually when respiration is normal, whenever the patient is at a normal dose, but even we have a higher dose, the patient goes in a depression, CNS depression, central nervous system depression. Same with the skeletal muscle. With an hypnotic doses, it has a little effect, but in anesthetic effect, the muscle contraction is get reduced. Already we had seen in general anesthesia, whenever there is a surgical anesthesia, that surgical anesthesia, most of these muscles should get relaxed. So this is what the anesthesia. So muscle contraction is get reduced, as well as excitability of this muscle is also get reduced whenever it is an anesthetic dose. Along with this, with cardiovascular system, hypnotic produces slightly decrease in blood pressure as well as in a heart. And at higher doses, it shows marked fall in blood pressure due to the ganglionic blockage, depression of the vasomotor center, and direct decrease in a cardiac contractility. This is the reason why there is a suddenly fall in the blood pressure. And reflux, and again, if suddenly withdraw that barbiturate in reflux, we could notice tachycardia. We could notice tachycardia. With respect to the smooth muscle, with respect to skeletal muscle, we have seen that is the muscle contractility is get reduced. With respect of the smooth muscle, the tone and motility is decreases. At higher doses, there is a peristalsis movement reduced. There is a decrease in a peristalsis movement. And on bronchial and uterine muscles, all these are shows there is no specific significant effect shown on this bronchial as well as the uterine muscles. With respect to kidney, the urine flow is get reduced by decrease in the blood. As blood pressure is decreased, urine flow is decreased. See, it is dependent on each other. As blood pressure is get reduced, definitely the flow to the kidneys also get reduced. As the flow to the kidneys get reduced, definitely the urine flow is also get decreases. So formation of urine is decreased because of the decrease in the blood pressure. As well as there is an increase in antidiuretic hormone. There is an antidiuretic hormone releases. And with barbiturate higher dose, it shows oliguria. There is a markedly decrease in urine formation. So it is correlated that is the reduces urine flow, that is an oligover. And here about up to the 400 ml urine is get out from our body throughout the day. This is the one of the very important role of this barbiturate with respect to our metabolism. And as we see the metabolism, if we know the word metabolism, it is related with the organ liver. So barbiturate stimulate the microsomal enzyme system. This is one of the very interesting and surprising effect that remaining all the systems are get depressed, remaining all the systems are get inhibited, but in liver system is get stimulated. The microsomal enzyme activity is get stimulated, and as there is an increase in the microsomal activity, definitely metabolism of drug is get increased. And this is the reason why it is called as Why we can consider it as the tolerance of the barbiturate is increased. Why? Due to the increase in microsomal activity, the effect of the barbiturate, whatever we need, we are not getting. Initially, if we are having a 10 milligram of barbiturate, after certain period of days, 10 milligram is not sufficient for producing its effect. Why? Because at that time, this liver activities get enhances, microsomal activities get increased, and due to increase in the microsomal activity, whatever the quantity of drug, 10 milligram drug is get metabolized by this enzyme system, and due to that, that is we called as we are not getting effect. In terms, we are calling as it has a tolerance. So this tolerance, to reduce this tolerance, again we need to have a higher dose of a drug to get this effect. So this is what about the effect of barbiturates on this system. Then what are its application? Where does we could prefer? Definitely where is important use, that is as a hypnotics and sedative. Many times initially this hypnotics and sedatives are get investigated for the purpose of the particularly barbiturate is investigated for the as a purpose as a hypnotic sedative, but nowadays this barbiturate role is get replaced by this benzodiazepines. Barbiturate role is get replaced by this benzodiazepine. Already we discussed that barbiturate is one of the selective drug for the treatment of the convulsion, and as well as it is used as a pre-anesthetic medication. It is one of the very combination in anesthesia. We had seen why pre-anesthetic medication is needed, and here this drug is used as a pre-anesthetic medication. And next one is sometimes it could be also used as a general anesthesia. The ultra short acting barbiturate like thiopental sodium is could be used as a general anesthesia because its duration of action is less than 1 hour. That's why it could be preferred as a general anesthesia. So this is what about the therapeutic application of the barbiturate. Now, what could be the possible adverse effect of this barbiturate? The barbiturates are one of the famous effect, that is hangover effect. Any person who is having alcohol, any person who is having alcoholism, or any person who is using CNS depressant, if he is not habitual to that, then next day morning he is having that hangover effect. This hangover effect with hypnotic dose is possible and produces, sometimes it produces mental confusion, impairment of the performance, as well as there may be some accidental possibilities due to the hangover effect. Next one is an idiosyncrasy. Now, what do you mean by the idiosyncrasy? Usually it could happen that suppose one example, we took an example of the barbiturate. What is the role of the barbiturate? Barbiturate is usually used as a CNS depressant, but due to idiosyncrasy, we could find that these barbiturate produces excitement. The barbiturate produces excitement. This is the most important thing. Interestingly, what the barbiturate does? Barbiturate reduces the central nervous system. But with patient, what we are observing here is excitement. This is called as an idiosyncrasy. And some patient it shows intolerance like rashes, swelling, eyelids, lips, swelling to the lips. It could be happen with barbiturate. That is the hypersensitivity, as well as tolerance, intolerance. Both the cellular and pharmacokinetic tolerance developed on repeated use. About that we already discussed. Cellular tolerance means whenever cell is having that dose of 5 milligram, initial dose of the 5 milligram, suppose to bind that barbiturate we could have a 5 receptors, but as we increases the dose, or as we taking a drug as a longer time, that 5 milligram is, instead of this 5 receptor, again more receptors are get developed on our cell, and that's why the body is telling that this 5 milligram is not sufficient for producing such effect, we need more. So it's a cellular level. And kinetic level, that I already told you, already we discussed it, because of this microsomal enzyme activity it produces this effect. This is the reason why that barbiturate produces tolerance. Barbiturate develops psychological as well as a physical dependence as it has abuse liability. That is one of the very important thing. Dependency, physical as well as the psychological dependency. And if we withdraw the drug suddenly, then it produces the withdrawal symptom. The withdrawal symptoms, see, the barbiturate is a CNS depression drug. And as the drug is get available in our body, the CNS in a depressed state. And when we suddenly withdraw the drug, at that time what happens? The drug is not available, the brain is get excited. And as the brain is get excitement, it produces one condition that we call as a convulsion. That is one of convulsion. As well as some excitement, some other effect like hallucination, delirium, and even it is under we are not in treatment, not under control, the patient may lead to death. This is also possible if the quantity depend upon the quantity of drug, how much quantity of drug it is get administered. So this is what about the pharmacological, different pharmacological action of barbiturate on our body, on different system of body, like on a central nervous system, cardiovascular system, respiratory system, skeletal muscle, smooth muscle, as well as respiratory system. And what are the possible its adverse effect depending upon its use, as it is a dose dependent. So dose is variable, it has some variable adverse effect. And what are the its application, therapeutic uses application, that we have seen in this lecture. So if you have any doubt, if you have any query, let me know. I'm trying to clear you as much as possible. Thanks for listening me.